Hi, my name is Anthony Spadaro, student of Central Queensland University. Today I will be talking to you about the potential positive and negative psychological effects of anabolic steroid use. Anabolic androgenic steroids, also known as anabolic steroids, are synthetically derived by the male hormone testosterone. Anabolic essentially means to grow the cell, where androgenic is effectively the maintenance of masculine characteristics. Testosterone is a hormone that stimulates male sex characteristics and the growth of muscles and bones. Testosterone is also found in females, but in a reduced capacity. Anabolic steroids promotes further growth of skeletal muscle and the development of male sexual characteristics. Anabolic steroids is used by a wide variety of people. Non-therapeutic users such as athletes use anabolic steroids for strength, power, acceleration, essentially to gain a competitive edge over their competitors. Bodybuilders use anabolic steroids for physique and to increase lean muscle tissue and decrease body fat percentage. Certain occupations may also use anabolic steroids, such as security guards, police force, to increase their size for an intimidation factor. And cosmetically, in a recreational sense, people want to get bigger, to look better, to feel better, and they use steroids as a result of maybe reaching a training plateau. You have the therapeutic patients that use anabolic steroids for an improvement to their quality of life. These people such as HIV patients, women with endometriosis, people with clinically diagnosed depression may also use anabolic steroids, osteoporosis patients, and the elderly for muscle wastage. Anabolic steroids can be administered by injection or taken orally. One practice of administering anabolic steroids is known as pyramiding. This essentially starts with a low-dose cycle, increases gradually over the next 6 to 12 weeks, and then slowly reduced to zero. The slow reduction to zero will ease the dependency of the anabolic steroid. Some people find that if the anabolic steroid is reduced at a faster rate, they feel the need to stay on anabolic steroids. The psychological effects of anabolic steroids, both positive and negative effects. Run through the positive ones first. So when on the anabolic steroids, people have found that their self-esteem increases, self-confidence and image increases. Some reports have found that certain individuals feel invincible when on anabolic steroids. Another positive effect is the elevated arousal, increased academic performance also. The negative effects when off anabolic steroids, the increased aggressive behavior, depression, dependence, sleeping issues, violence, increased anxiety, increased fatigue, suicidal thoughts, and there may be a disconnection from family members. Not all families will support an individual who chooses to use anabolic steroids, so there may be a certain disconnect from family. Vasallo and Ulrich in their study found that when anabolic steroid cycle is terminated, their self-confidence level dropped below their pre-existing anabolic steroid use. When this happens, they found that the mental edge and loss of confidence was a motivating factor to continue to use AAS. One thing we'll find over the next 3 studies is that dependency seems to be a reoccurring effect of the use of anabolic steroids. Evans found that the termination of anabolic steroid use has been associated with hypomania, increased aggression, violence, and depression. In another study, they found that 6 out of 8 weightlifters had withdrawal symptoms after taking anabolic steroids. Symptoms include depression, fatigue. People found that they weren't happy with their bodies, and they also met the criteria for dependence. Copeland, Peters and Dillon found that 78% of participants from a self-reporting questionnaire were found to have a full range of dependency symptoms. The positive effects of anabolic steroids, in a whole, it just, you would say that most people use it for self-confidence and feeling good about themselves. Vassallo and Ulrich found that 37 out of 39 participants reported an increase in perceived levels of self-confidence. The positive effects of testosterone on mood are well established, and several studies have found that testosterone replacement is used to substantially reduce negative mood states relating to depression, self-esteem, and fatigue. Ulrich and Ewing found that 9 out of 10 men spoke positively in regards to their usage experience. 1 out of 10 men, however, found that their experience was negative based on guilt and guilty feelings. However, most of the participants found that the positive effects associated with anabolic steroid use was an increase in strength, increased muscle mass, the fact that they reached their physical goals. Their peers recognized that they had improved their muscle definition, and also the mental focus was a factor that could lead to the dependence of anabolic steroid use. Are anabolic steroids beneficial or detrimental? Well, in some cases, anabolic steroids may improve the quality of life for someone who has a therapeutic use for the drug. However, the dependency of anabolic steroids may provide the user with other unwanted long-term psychological effects. For the case of the non-therapeutic users, there is enough evidence to suggest that the anabolic steroids, if overused or if the dosage is increased, can cause major psychological disruption and increased aggression. However, there is no evidence that suggests anabolic steroids are detrimental if used within the safe limits. Thank you for listening to this presentation, and if you have any questions, feel free to leave a comment below. Here are some of the references that I used in my presentation. Thank you.